In the arid lands of northern Kenya, the effects of years of drought are evident. Across the Horn of Africa, 13 million people are in dire need.
It's a desperate situation with an enormous number of lives, particularly of children, at very great risk. Britain has been in the lead in helping stop this by ensuring that there is food and medicine and water to help. But it's going to get worse before it gets better. We've got to do everything we can to ensure that this doesn't happen again in the future, as well as helping those who are at great risk today in the Horn of Africa.
Here in Kenya's poorest region, drought, poverty, rising food costs and disease all combine. British aid is helping to save lives.
So we're here in Turkana County, which is the biggest county in Kenya. It's also the poorest county in Kenya, where we have 95% of the population living in absolute poverty. They live in less than $1 a day. At the moment we are suffering from the extreme drought that's affecting the entire Horn of Africa. And after successive years of failed rains, both short rainy season and long rainy season, it's meant that the population in Turkana are really suffering greatly through the drought.
At the hospital in the main town of Lodwar, a mother feeds her malnourished child plumpy nut, a high nutrition food. Staff treat malnourished children from across the region. Cases of malnutrition here have increased fourfold this year. This children's ward was refurbished with British funding. 10-month-old Kinyonga was brought by her mother from her home more than 300 kilometres away, malnourished and suffering from pneumonia. Her mother Naomi said that when she was referred here she was given treatment, blood and food. Before she was admitted, her child couldn't eat, but now if she sees someone else eating, then she will eat as well. She's pleased that her child is doing so well. This vast county has 3 doctors who, along with nursing staff, provide life-saving care and treatment.
Okay, what will happen to these children if they do not have a chance of coming to this stabilization center in this hospital? They're going to die. Most probably they die, they succumb from the complications of malnutrition.
Britain is also funding longer-term projects here. Wilson is blind. He receives a monthly cash transfer under a scheme called the Hunger Safety Net programme. With the money he buys food and clothes, but also materials for carpentry. He sells his work at market. 27,000 of the poorest households across Turkana receive such support, which is designed to help them to help themselves. In this drought-hit part of East Africa, aid from Britain is meeting huge immediate needs. It's also helping the very poorest people to prepare for future droughts and for more tough challenges ahead.